Should we change it? We change it. Mm, 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 mm. Let's look right. Let's do this. Let's turn it a bit here. Reduce it. Yes. Good. Welcome to this live. Let me know if you can hear me and if this video is good. Let's see. Okay, we are talking about something very important today. So I just wait a few minutes for people to join in. And as you join in, I want to say very good morning from this side. Do let me know where you are joining from. Where is your location? I'm glad to have you here. It's a wonderful community, health enthusiasts. Okay. There seems to be something different about the lighting, but just let me know if you are comfortable with this lighting. Welcome to this live. Thank you for joining in. Let me know where you are joining from. Who is with us now? Welcome. It promises to be an interesting discussion, and it's something that affects billions, millions of people actually all over the world. Of course, there are many disease conditions, and interestingly, we are getting to know and find more ways to manage and treat these conditions. Sometimes some of these conditions are actually, in a way, localized, but many are actually like a global burden. And one of those which we'll be talking about is hepatitis. Hepatitis. And if you are joining in, let me know where you are joining in from. Let me know if this audio is good. Let me know if you are okay with this audio or if I need to make some adjustments, and kindly double tap on your screen and also share this live session with your community. Someone in your world may benefit from this um, discussion, this session. Okay, sometimes we have people with questions, fears, and then due to misinformation, some are due to negligence, some are due to lack of awareness, actually. So, one of the things that we are doing at this time is to bring awareness and some clarifications on some of the concerns that people may have, that people actually have regarding this hepatitis. All right. So let me know where you are joining from. In this. Okay. All right. So as I wait your comment in the chat, we'll just get into this. As I said, as a matter of introduction, there are many disease conditions all over the world, and people have challenges with having the correct information. Thank God for search engines. You know, you have many information available online, and of course, with the advent of AI, you know, sometimes you get some deep understanding of these things. But when it comes to medical care, there is something important, and that is the need to personalize and individualize this care. And as a family physician, a medical doctor, for those that are just coming across this uh, channel and live session, I'll just quickly let you know that I am a medical doctor practicing in Nigeria, currently in Nigeria. And then I am committed to helping people discover what they need to do and then get into doing those things to have the good health that they deserve. And on our part, we have many things to do. And doing what we need to do, we go a long way. Usually, actually, goes a long way to help us to be who we are to be or to do what we are to do. So, whether it's regarding your health or any other area of your life, interestingly, I like talking about this definition of health. According to the World Health Organization, health is a complete state of physical, mental, and social well being, not merely the absence of disease or infirmity. Uh, so, if we have to talk about you being healthy, we have to look at uh, you as an individual, your complete person. We look at your spirit, which is a foundational aspect of every man. You know, and some people don't believe that, but it doesn't mean that it doesn't exist. Okay, there's that spiritual side, and then there is the soul aspect of man, and then there is the physical aspect. But most times, people pay attention to the physical aspect, neglecting the other two aspects. Of course, they are interconnected, and one definitely affects the other. So, if you are not taking good care of your spiritual health, or you are not conscious of what you are allowing in your soul, then your physical state may be disturbed. Okay, so for us not to have an incomplete person, because what God wants is for you and I, according to the Word of God, the Bible. I'm a Christian, so I believe in the Word of God that talks about, I wish above all things that thou mayest prosper and be in health, even as your soul prospers. So, God's commitment to each and every one of us is that we will prosper, not just in our spirit, because very important as a foundation, but that your soul, that your mental health, that your heart condition, when I say heart, I'm talking about your mind actually, will be according to what God wants, that you are healthy, that you are prospering, and then physically you are manifesting this. But what on the other side, what the devil wants is that you are disturbed spiritually, you are not in that state that you can be fit to to do all that God wants you to be and to do. Then also the soul, so many concerns, people are anxious. For example, somebody could receive a diagnosis of hepatitis, and then that changes so many things, gets them into depression, they get them into anxiety mode. Some people could even attempt suicide. Some people may have even committed suicide because of such a diagnosis. Okay, so that's why it's important to have correct information and then to act according to the information that you have. So, as a medical doctor, I'm bringing to you uh, some information relating to hepatitis. And then 28th of July is actually the World Hepatitis Day, celebrated all over the world. So I don't know if you are aware of that. Let me know if you know in the chat. I want to say welcome once again to everyone joining in. Please let me know where you are joining from. You can just drop a comment in the chat. I will I'll be glad. I'm glad that you are here. Let me know if you are a member of the community or you are coming across the channel for the first time. And then you can double tap on your screen, kindly double tap so that more people can get notified about this live session. Okay, I also want to be sure that I'm very audible and then that my lighting is okay. Okay, these are very important aspects of showing up on video and then talking to the audience. Thank you, thank you, thank you. Good to have you here. I can see uh, Charles Gold saying hi. Thank you for joining in. I'm glad to have you here. Let me know, are you joining my live session for the first time or you have been a member of the community? If you are joining for the first time, I really want to say welcome and thank you for um, just coming in to join this discussion on hepatitis. And let me know where you are joining us from. Where is your location? I'll be so glad to know where you are watching from. Then let's have more responses. I really want to know where people are joining me. Oh, Charles Gold. Thank you. Thank you. Um, I'm not sure it's Mr. or Mrs. or Miss, Mr. Pardon me. I'll just say Charles Gold. Uh, Welcome. Thank you for joining this live for the first time. So I celebrate you. Thank you for tuning in. May I know your location? Where are you watching from? Where are you watching from? Where are you joining this live from? Let me know where you're joining from. Mm, 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 mm. Okay. We hope that more people will join in so that this information and then there will be opportunities for questions and then the answers will be provided. Okay, according to the theme for this year's World Hepatitis Day, which is celebrated globally. I don't know, in your location, it may be, it may still be 28th of July, 2025. But on this side, we have moved into 29th. So I'm coming up to share so that people in different parts of the world will be able to connect and then we can learn together. All right. So the theme for this year's World Hepatitis Day is actually let's break it down. Let's break it down. And that's one of the things we'll be doing on this live. So let me know what questions you have regarding hepatitis. So there's an urgent call, globally for more commitment on the management of hypertension, need for financial commitment, social aspects of it when it comes to social, dealing with the stigma, dealing with the concerns of individuals and families, and even employers. Sometimes people get to have that diagnosis and it changes a lot of things about their employment and receive such encounters with people who probably routinely or in employing or seeking for employment get a diagnosis of hepatitis, and commonly hepatitis B, and then uh, need for further clarifications, need for treatment for some people, and then uh, the feedback to those employers. Now, there's a need to avoid stigma, to deal with the stigma associated with hepatitis or even any other medical condition. People get diagnosis and then there are a number of things that happen around them. Some people change, some people begin to avoid, and how we talk about how to prevent hepatitis also in the course of this discussion. All right. So basically, the definition of hepatitis is that hepatitis is a viral infection affecting the liver. Basically, I'll just explain that when it comes to inflammation, it's what happens to the liver because of an infection, even though there are other causes of that inflammation or condition. So when the liver is inflamed, by the way, the liver is located usually on the right side of your abdomen, and it performs different functions, metabolism, detoxification. It does a lot when it comes to uh, the function, blood formation, the function, and the whole connection with the body, the other parts of the body, other systems. So if an individual has any form of trauma in form of toxins, medications can also cause this inflammation apart from the infection. Infections generally, could be as a result of bacterial infection, fungal, could be viral. So commonly, what affects the liver is the viruses, viral infection. So, and there are different types, including hepatitis A virus, hepatitis B virus, hepatitis C, hepatitis D, and hepatitis E. Now, I want to just mention that there's a global burden when it comes to hepatitis, and then millions of people all over the world. There are billions of people in the world, but about 300 million people are said to be affected by hepatitis. That's a huge number. That's a huge number. And then about 1 million people are said to die from hepatitis yearly. That's a huge number. So if we consider the burden, whether it has to do with mortality or even morbidity, that's talking about relating to death and then relating to the illness and the effects on the whole person, the health of the individual. So that can affect individuals' effectiveness in life. Okay, so but it's not actually supposed to be. So on this live, in this discussion, we'll be looking at those different areas that we need to consider when it comes to hepatitis. If you are just joining in, let me know where you are joining from, where is your location, and what time it is in your location. Mm, 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 mm. Welcome to this live. Let me know if you can still hear me. I hope I'm audible. I hope I am audible and the video is good. So thank you for the like. You can see there's a like, and then we can have more likes on this live so that more people can get notified. That's the way the system works, to get more people notified about this live. Mm, 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 mm. So just wait a bit more for more people to join in. All right. So still talking about these facts, global, talking about the statistics for global, for this global burden. Actually, when it comes to Africa, we have billions of people. Uh, Nigeria, millions. America, millions. But generally, millions of people are affected by this condition. So it's something important. It has not just affected individuals, it's something that affects relationships. People are planning to get married and they have to do routine medical checks, and then someone discovers that they have hepatitis. Now, it changes for many people, it changes many things. It affects decisions sometimes, it affects procreation, it affects different sides. So people get to discover that they have hepatitis through different means, through different channels. Some people maybe for preschool, trying to get into a particular course, and then they have to do this medical screening, and other people for employment, during employment screening for employment, other people during medical outreaches. Sometimes people just get tested and then they find out that they have hepatitis. Others from routine checks, maybe in the hospital, the doctor just feels from interactions that this individual needs to have this hepatitis test done. So people get to receive the diagnosis through different means, different ways. Okay, but the important thing is to know what to do when an individual gets this diagnosis. And we will definitely delve into that aspect. But generally, hepatitis A and E are usually con- passed, contacted through the fecal and oral means. So anything that goes through the mouth, goes through the anus, then these are channels through which an individual can contact that virus. But for hepatitis B, C, and D, usually pass through fluids, talking about blood transmission, other fluids in the body. Okay, so but over 296 million people are actually living with chronic hepatitis B. Can you see the numbers? So there are more people living with hepatitis B than other types. 58 million people have chronic hepatitis C, while A and E are not as common. Okay, so what exactly are the other things that you need to know when it comes to hepatitis. I've talked about the definition. There are other causes apart from these viral infections. There are other causes, and those causes include alcohol abuse. Some people don't know, and I need to let you know that alcohol does not have any benefit in your body. So, alcohol is toxic, and so it affects the liver, especially when taken in high concentrations, high quantity. So, hepatitis can also occur from alcohol toxicity, can also occur from medications. There are some medications that are actually very toxic. For example, paracetamol is one common over-the-counter medication, but overdose on paracetamol can also cause liver damage. And then autoimmune disorders or other causes. On this side, if you are in Africa, on this side, uh, most people tend to go traditional sometimes. More people, let me not say most, go traditional, such that they have access to herbal concoctions and for many things, for different things, for treating, let's say, for malaria, for typhoid, for different things. Okay, but little do people know that these concussions, even though they are leaves, these are natural leaves behind me, they're flowers, but even though this may have some beneficial measured, but the overdose, the quantity that that can lack of quantification is what really affects the body in such a way that it could affect the liver and cause that toxicity. So apart from the liver, other organs can be affected. The kidneys can also be affected. Two people can get this condition of the liver through these different means. So what are the, before we go to symptoms, I'll just quickly talk about how these viruses commonly can be contacted. Okay, I've talked generally that they can be contacted through the fecal and oral means for the hepatitis A and hepatitis E. So if the virus is present in an individual, and then the individual gets to contact in contact with the food, the virus gets in contact with the food that another individual is to take, is contaminated, then there's a possibility that any individual that comes in contact, that takes, ingest that virus, will get hepatitis A or E. Now, the body is programmed in such a way that it can actually fight. Some people are able to fight this virus, while some other people get overwhelmed with the virus. So that's why they are not able to deal with it. So some cases may be acute, such that it just comes for a short period. The individual is able to build or fight it, with their immune system. While for some people, it becomes chronic. That is, continues to exist in their blood system. Okay. But for hepatitis B, C, and D, I would say that they are actually contacted through sexual means, through sharing of needles, sharps. These are means by which hepatitis B, C, and E, B, C, and D can be contacted. Now, I want to say something about hepatitis D. Hepatitis D cannot actually exist on its own. Okay, so if an individual is diagnosed of hepatitis D, most often than usual or normal, they already have existing hepatitis B. And the super infection is what actually makes it worse. When an individual has hepatitis B, and welcome back, hope you can hear me. Let me know if you can still hear me. Let me know in the comments if you can hear me. Please let me know if you can hear me. Am I audible? Thank you for the like. Thank you. Thank you so much. Thank you. Please drop in the chats. Yes, if you can hear me. And just type yes if you can hear me. So as much as possible, trying to make this, to break it down as the theme for this year, what Hepatitis Day says. Break it down. We need to break it down, make it clear as much as possible, and then um, letting you know how you need to go about it, whether in terms of the need for screening or the need for treatment, follow up. So, welcome to the live. If you are just joining us, let me know where you are joining from. Thank you for joining in, and kindly double tap on your screen to like the live. Let me know who is with us and where you are joining from. Thank you. Thank you. Thank you. Charles Gold, are you still here? Charles Gold. And remember to subscribe to the channel for more health content, health tips. So we're still discussing hepatitis, understanding what it is, the diagnosis, what are the symptoms, how is diagnosis made, and then treatment available for hepatitis. Lady J, thank you for joining in. Welcome, Lady J. So glad to have you here. Thank you. Thank you for tuning in. Thank you. Is this your first time joining my live, watching? Uh, or have you been a member of this community? Yeah, welcome, Lady J. Thank you. Thank you. Kindly confirm what time is it in your location, UK, in London there? What time is it? Okay, yeah, welcome, Lady J. Thank you. Thank you. Thank you for joining the live. Thank you for tuning in. Thank you for, you can double tap on your screen for the like. That way, actually, the system gets more people notified about the live, and I'm sure there are many people that should benefit from the information we are sharing on this platform and from this channel. Oh, okay, 508. Okay, first time. Okay. The DJ says first time. Thank you, thank you, thank you. I'm sure you will subscribe. Kindly subscribe to the channel so that you can get regular updates on what we do. We talk about health, wellness, lifestyle. Sometimes I share my YouTube experience, and it's a wonderful community, and I'm sure you will find this community interesting. Okay, so it's five. Okay, so we're about the same time. Um, Streaming live from Lagos, Nigeria. Um, so it's about the same time here. Okay, so thank you, Lady J. Thank you. All right, so we're talking about hepatitis. So what do you know about hepatitis? Have you have you had any reason to be screened for hepatitis. So as I was saying, I was trying to give some clarifications on the transmission of these viruses. All right. So, but for hepatitis A now, I as mentioned earlier that it's usually through the oral and fecal route, and so that means people can get infected uh, through food and water. For example, people traveling to places with poor sanitation, some parts of Asia, and it's not even just about Asia, any part of the world where there is poor sanitation, the individual is at risk of contacting the hepatitis A, hepatitis E. So as I mentioned, for hepatitis B, C, and D, usually through blood contact. So people who are at risk include people who have many things to do with blood. Okay, let me start even with health professionals, doctors, nurses, laboratory scientists, people who come in contact with blood usually are at risk of contacting this virus or viruses if they come in contact with blood of contaminated of infected persons. If they come in contact with contaminated blood of infected persons, so they are likely to get infected. Other people include even children, newborns. If a mother has it, there's a possibility of transmission to the unborn or the newborn. Okay, so what's important is to also note that these things can be prevented. Okay, but before we go into that, let's talk about some of the symptoms. Okay, Lady J, let me look at the chat. Okay, you're welcome, Lady J. Lady J says yes. Okay, saying well done. Thank you, Lady J. Thank you. Thank you for your comment. Lady J says, really? Yes, really. Okay, what exactly are you responding to there when you say really? Really what? Really what? Lady J, what are you responding to? What are you responding to saying really? All right, so still trying to differentiate these viruses. It said that globally, estimated 1.4 million people are affected by hepatitis A. And then these regions that are actually more affected include Sub-Saharan Africa, South Asia, Middle East, Latin America. They have the highest prevalence due to poor sanitation and then lack of clean water. Those are some of the reasons why they have prevalence of hepatitis A. Don't forget that I've said that uh, this is usually contacted or transmitted through the fecal oral route. Okay, so there are other. Let me talk about hepatitis E. Talking about oral routes for hepatitis E. Okay, we have. I know. Let me know if you are fine with this lighting. So I adjust it. Okay. Better. Let me know if you are okay with this. What about now? Can you hear me now? Can you hear me? Can you hear me now? Can you hear me now? Am I audible now? Can you hear me now? Can you hear me? Okay, so you can hear me now. Thank you. Thank you so much. Thank you. Okay, so um, that's why we are doing this. We need to share information and knowledge of these things. Knowledge is power, especially when it is used appropriately. Okay. Hepatitis B, talking about the global prevalence of hepatitis B, about 290 million people are said to be living with chronic hepatitis B, which is most common. And then new infections, about 1.5 million new infections are discovered annually. So that's a huge number. So we need to talk about this. Hepatitis B is said to be responsible for about 800,000 deaths annually. 800,000 deaths. That's a huge number for mortality. And then the complications that can arise from hepatitis B include liver cirrhosis, liver cancer, and interestingly, hepatitis C, which we'll also be looking at now, is one common cause. All the other ones can also cause liver cancer, but one common uh, cause, reason for developing liver cancer is as a result of infection with hepatitis C. Okay. I can see Rajesh Spicy. Very good morning. Welcome, my people are joining in more now. Community members are joining in. Rajesh, I wanted to welcome Lady J. She's joining the community, coming across the channel for the first time today, and she's watching from the UK. Rajesh from India. Very good morning, Doc. Thank you, Rajesh. Good to have you again. So we're catching up again. It's good. Thank you for the like. I really appreciate. I appreciate. Sometimes because maybe we think the time zones may change. So I usually like to ask, Rajesh, what time is it in India? What time is it there now in your location? Or where are you watching from now? Where are you watching from, Rajesh? I hope you can hear me. Okay, Lady J says, thank you so much for having me. I'm enjoying the doctor. Very interesting. Thank you for the feedback. Thank you, Lady J. Thank you so much. Thank you. So one of the reasons why this topic really getting involved in this discussion is the fact that we see I see people as a family physician. I come, have opportunity in the primary care to see individuals who come into the clinic or who get admitted because of this infection. Now, I remember when I was in medical school, over a decade now, I was in the emergency. I think it was surgical emergency that day on a call and trying to also help, assist, attend to patients. Okay, but there was this particular man that was brought into the emergency that day. And then from the history, had the history of travels. He had this history of yellowness of the eyes. He had abdominal swelling. You know, he had these symptoms. I think he had fever also. So he was chronically ill looking. When I say chronically looking, he had lost weight, he was looking wasted, you know, the bones were showing obvious that he had lost some muscle mass and all. So the diagnosis was actually hepatitis. Interestingly, within hours, was it 48 hours? With all that was done, it was already clear that the man was in a very bad condition. So he had a history of travel, he had a history of multiple sexual partners, and he was really at risk. And I think he was also get involved in alcohol and smoking. So he had multiple risk factors for hepatitis. And the man passed away. I can't forget that. And I mean, I was in medical school then. I was in medical school. So but that memory, registered and gives me a picture of the complications that can arise from hepatitis. I've mentioned liver cirrhosis, I've mentioned liver cancer, and these are deadly conditions already. When the liver begins to lose its function, then the individual may not survive for long. All right, so uh, let's talk about hepatitis C. Yes, the global prevalence. I can see more people in the chat. Vijaya, wow, good to see you. Vijaya saying, "Hi, brother. Good morning. Happy Tuesday." Yes, happy Tuesday. Good to have you here, Vijaya. That's another wonderful member of the community from India, right? When it comes to the community, I get to see, from the YouTube analytics, you get to see that we have more people, more members of the community, the audience in United States of America, and then of course Nigeria second, followed by India. So we have more people, or the third category of people who are members of the community are from India. So this shows the commitment that individuals have for their own health and the love that they have for this, the doctor and the community as a whole. So a happy Tuesday, Vijaya. Benaya, and says okay, it says fifth, so that you gave the fifth like. Thank you for the like. Glad I'm glad to have that. Thank you for your support. Looking forward to more of your support. Thank you for showing up and not ignoring the notification. Thank you, Vijaya. So how are you doing? If you are just joining in, everyone, welcome to this live. We've been talking about understanding hepatitis, the causes, we look at the symptoms, how the diagnosis is made, and then the management. So we're looking at statistics, which is very important. This year's World Hepatitis Day is also usually celebrated yearly on the 28th of July. And the World Hepatitis Day emphasizes the need to break down this thing. It looks big. It looks uh, like a concept, even though it is really not. It's not a concept. It's actually a medical condition that we need to talk about. Condition of the liver, majorly, that can also affect other organs in the body. So for global prevalence of hepatitis C, about 58 million people actually have chronic hepatitis C. And then about 1.5 million people are affected yearly, new infections yearly. And it's responsible for about 290,000 deaths. That's talking about hepatitis C. And that's it's usually because of the complications. Talking about liver cirrhosis, talking about liver cancer. So these are usually responsible for the mortality when it comes to hepatitis C. Thank you, Vijaya, saying blessings to you, brother. Thank you. Thank you. Thank you. Just give me a minute. I'll be with you. So just a minute. Is it okay? Can you hear me? Excuse me. Very important thing is hydration when it comes to living a healthy life. Living healthy, hydration, and your diet is very important. So let me know if you can hear me. Am I audible? Am I audible? Please let me know in the chat. Can you hear me? Can you hear me? Vijaya, Lady J, are you still there? Let me know if you can hear me. Rajesh, Charles Gold. Let me know if I am audible so I don't just keep talking to myself. Am I audible? Welcome or welcome back. Let me know if you can hear me. Am I audible? Please, I need your feedback. Thank you. Please, can you hear me? Let me know if you can hear me. Let me know in the chat if you can hear me. Okay, Lady J says I'm here. Thank you, Lady J. Still good to have you here. Thank you. So that means you can hear me clearly. So we still talking about the statistics. Finally, we look at hepatitis D. This is my video now. How about now? Let me know when you are back. Let me know if you are connected It's just network differences. Can you hear me now? Lady J, are you still here? Let me know if you are connected now. And anyone who is on the live, anyone just joining in, let's know where you are watching from. Sometimes differences in network, differences in time zones. Okay. There's a sixth like. Thank you for the like. May I know who is is it just joining us or returning or joining back? Thank you for joining in. Thank you for joining this important discussion on hepatitis. It's a very good morning from this side. Let me know where you are watching from. Thank you for the sixth like. Kindly let me know who is just joining in and where you are watching from. Now we have quite a number of people joining in. People also have to switch between watching and doing other things sometimes. So I understand that. But I want to be sure that I'm still audible. Let me know in the chat if I'm audible. Lady J, if you don't mind, if you are here, what do you do, Lady J? Lady J, are you a content creator also? Well, we get to know more. But I want to be sure that I'm still audible so we can continue our discussion on this important topic. Please drop a comment in the chat. Okay, I believe that you can hear me, so I just continue. Talking about global statistics, the prevalence of hepatitis D. As I mentioned earlier, hepatitis D cannot exist singly on its own. It cannot. It actually coexists as co-infection, or actually as super infection with hepatitis B, and that makes it worse. So if an individual has hepatitis B, they also need to be screened for hepatitis D. And if hepatitis D is present in their blood, then they have, so to say, a worse prognosis if not well managed. So the prevalence for hepatitis D is that there are about 70 million people who are infected with hepatitis D, and this, as I mentioned, occurs in those who are already infected with hepatitis B. Hepatitis D actually increases the risk of severe liver disease and death compared to hepatitis B alone. Hepatitis D increases the risk of severe liver disease and death than due to hepatitis B alone. Okay. And where are the high risk regions for hepatitis D? They include sub Saharan Africa, Amazon Basin, Central Asia, and parts of Mediterranean region. They have the highest prevalence when it comes to hepatitis D. So now, what are actually the symptoms? Most of the time, is asymptomatic, because sometimes by the time people are finding out, as I mentioned earlier, it could be from routine checkups, it could be from screening for school, screening for employment, screening for travels, routine checkups during medical outreaches. People have opportunities to be checked, and so people get to know during these periods. And interestingly, as I mentioned earlier, there is the possibility of transmission from mother to child, and so some people get to know that they have hepatitis during pregnancy. So that's part of the screening. Several tests are done as part of routine antenatal care. So such a woman will have not just HIV screening, retroviral screening, also need to have hepatitis screening done, and other tests, blood levels, ultrasound scan, as the case may be. So these are ways by which people can come in contact with or get to know that they have hepatitis. And the fact is that many people have been devastated by the news of uh, having hepatitis. Okay, they have been devastated. And so I'm doing this to also help to encourage people. There are people that will benefit from immediate treatment, you know, but there are other people that will benefit from measures to prevent complications and worsening of the infection or condition. So I will talk about all this in the course of this session. We'll talk about preventive measures against hepatitis. All right. So since we know about this virus now, we know how it is transmitted, the different types, and don't forget that I've said that it's not just the virus that causes the inflammation that occurs in the liver. When we talk about the inflammation, the infection is one cause. Medications can also cause inflammation. Toxins, autoimmune diseases, these are other causes of inflammation of the liver. So if your liver is affected, in a way, it will lose its function. It will begin to lose its functions. Now, the inflammation means that, okay, the color is changing, is increasing in size, in some cases. And where there's cirrhosis, there's reduction in size. Where there's cancer, it could be hard, different features. It could lose the blood supply, will not be like it was in the normal liver. So many other features beyond the liver because of that condition. Now there are symptoms of hepatitis infection. So we look at the symptoms of hepatitis infection. Some people, like I said, don't have any symptom, so it is just from this routine check. So that an individual does not have a symptom does not mean that they are free from hepatitis. So the first thing is to ensure that you are screened, you have the test done, and to be sure that you don't have it. I have had the test done many years, and I have had a vaccination for hepatitis B. Okay, so that gives some protection, and we need to also do, I think after 10 years you also have to do another check and be sure that you are doing well. So screening is very important. So people that have symptoms, the infection, they have symptoms like feeling of tiredness, fatigue, feeling weak. Some people have loss of appetite. Some people have nausea. Some people may be vomiting. Yellowness of the eyes is another symptom of hepatitis infection. Abdominal pain, especially in the right, toward the right side, may extend to the central aspect, depending on the extent of the affectation of the liver and the enlargement of the liver. So I've mentioned yellowness may not just be limited to the eyes, yellowness of the eyes, yellowness of the skin. These are some features. So when an individual or you see someone around you, if you are noticing yellowness of the eyes or some abdominal pains, not all abdominal pain is due to food poisoning or malaria or so many other causes of abdominal pain. So you need to check. If you find someone around you with some of these symptoms, you need to see the doctor immediately, for proper assessment, proper history taking, and then necessary examination and investigations to confirm the diagnosis. Now, passage of dark urine is another possible symptom of hepatitis infection, and passage of pale stool. So many people with hepatitis B and C may not exhibit symptoms. That's the dangerous aspect of this. People don't exhibit symptoms, but by the time some are coming up, they are already having complications from the infection. So those are some of the symptoms. So how is the diagnosis made? Diagnosis of hepatitis. There are other symptoms that I may not have mentioned in the course of this discussion. But if you know any, you can drop in the chat any other symptom. Okay, that may be from infection with the virus. Then it depends on whether it's an acute or chronic condition. Some people present with fever, you know, some people present with body pains. There are many other non-specific symptoms of viral hepatitis. And talking about making a diagnosis, when you get to see your doctor, the first thing is definitely history taking. And if you get to know whether through routine screening, pre-employment screening, medical outreach, opportunities for screening, you know, it's not to bring fear to you, it's not to bring get you to depression. You should actually know what to do. The first step is to to see your doctor and get some clarifications. There are some people that actually need to have repeats of the test done. Okay, and that is to just confirm that the initial test is correct. And then there are people, if an individual actually has that diagnosis, it's expected that people around that individual, family members, close relatives, friends, people that the individual interacts with, should also have that screening done, which is very important. Prevention is better, and is better, and not, it's less expensive when it comes to care than the need to cure, the need to treat. So prevention is key. Now, what are the other things that your doctor will do? Doctor will take information from you. Some people present with yellowness of the eyes. Some people is abdominal pains. Some people nausea, vomiting. As I mentioned, some people may have dark urine, dark colored urine. Some people may have diarrhea, and pails too. So it is important to have an examination also done on you. So with your consent, your doctor will examine you. General examination will be done to check different features your body, and then specific examination of the abdomen to check for the size of the liver. So of course, to check for any area where there is pain, and to also check for the size of the liver. So some people have not just the swelling, but tenderness, pain elicited in that particular region. So these are some symptoms and signs when it comes to hepatitis infection. If you are just joining in, welcome to this live. We are talking about hepatitis, understanding hepatitis. This year's World Hepatitis Day was marked, or it's been marked on the 28th of July, 2025. So depending on your location, you are either still on 28th, or you are in 29th of July already. So, but we are talking about breaking down, debunking the myths, talking about what really this condition is, and then the way to go about its management. Now, we also look at the different tests that will be requested when it comes to screening for hepatitis. Majorly, initial test is the blood test for the virus. Okay, so the blood test helps to identify the virus. So depending on the type, different types can be tested. So if hepatitis B is being tested for, it's usually important to also check for hepatitis D. And also, it's important to do an ultrasound scan, okay, to check. It will also help to check the size of the abdomen and to rule out any other condition in the abdomen. Then another test, which is very important, is the liver function test. That's to help to assess the level of the enzymes that are being produced by the liver. And so when that is checked, if there are abnormal levels, also a sign that there is a damage occurring in the liver. Other tests, some people may be asked to do a CT scan. That's an advanced test to check for the details of, the liver. Okay, there's some other tests that may be done. There's something we call fibroscan. That will also help us to assess the different aspects of the liver. Okay, so these are very important things to do. So your doctor will personalize your care. The individual's care will be personalized depending on what the doctor discovers. So there are other tests that may be requested if the doctor is thinking of a liver cancer. There are levels of enzymes that may be requested. We call them tumor markers too, that may be checked to confirm this diagnosis. All right. So, what should we be doing when it comes to uh, treatment and management and prevention, basically? Okay, let's look at hepatitis A and E. As I mentioned, it's usually through the fecal and oral route, but it's actually interesting to know that hepatitis A and E usually are self-limiting, and then they what needs to be done is for the individual to receive supportive care. Okay, the individual should receive supportive care. Excuse me. Yes, supportive care is very important when it comes to treatment of hepatitis A and E. But for hepatitis B, an individual will benefit from medications. Usually, we also give liver tonics generally to help with the state of the liver. And then there are people that need, some further treatments, further tests actually need to be done. Okay, we'll talk about the viral load for the virus when it comes to hepatitis B. Um, Part of the screening, viral load. Also talk about the other aspects of the hepatitis, trying to uh, specify whether it's chronic or acute, whether the individual can be infective or they are in a low state where they cannot transmit the infection. There are other reasons, including the need to determine whether the individual needs treatment, antiviral medications, and then there's a need for proper monitoring for such individuals. So, doctor will give appointments for you to have regular checkup and then take necessary steps. For hepatitis C, there are direct acting antivirals, so it can be treated immediately, and it has high cure rates, even though it's also a cause, if not treated, can cause liver cancer. Now, what should you do apart from all these specific treatments for this hepatitis? How can you prevent hepatitis? So we've talked about the different ways by which an individual can contact hepatitis. But so if you look at those different ways, that means people should avoid poor sanitation. You should improve on your sanitation. You should improve on your environment. You should have increased cleanliness and hygiene, which is very important. Washing of hands with soap and water before food, after using the restrooms and all. Then they need to avoid alcohol. Alcohol has no benefits in your body. Alcohol, smoking, you need to avoid, on this side, we talk about herbal concussions. You need to avoid taking herbal concussions. And then drug abuse, self medication. These are other ways by which people can get their liver damaged. Okay, so if you overuse, or you abuse, or you overdose on medications that may affect the liver, because the liver actually is one organ that helps in detoxification. It also metabolizes the medications, some medications that individuals take. Okay, so when there is that burden over on the liver, then that can also worsen the condition. So for individuals that are being treated for hepatitis, viral hepatitis, they also need to have serious precautions against um, smoking, taking alcohol, herbal concussions, and abuse of medications. What else? There's a need for regular checkups, as I mentioned. Um, those tests may need to be done at different points in time. So let's talk about the need for, okay, avoid unsafe sexual practices to reduce hepatitis B. So, staying faithful to one partner, very important. Avoid sharing needles or personal items, razors, toothbrushes. These are means by which people can get to be infected with hepatitis B, C, and or D. All right. So what else should we be doing? There should be increased awareness as we are doing right now, and then increased opportunities for screening. So more people need to be screened because the fact is that if you don't have hepatitis, you as an individual you're at risk because there are people if you have more people around you who are infected and they are not being treated properly, then there's a tendency for you to be affected. So your household need to also be screened appropriately. What else? So vaccination, very important. Okay, there are um, vaccinations available in different regions. Different countries have their different schedules. For pregnant women, they receive certain doses over a period of their reproductive life. So that can help to prevent mother-to-child transmission. Even when a baby is born, the newborn also receives some immunization, and then there's the routine schedule for immunization for hepatitis. So sometimes, depending on your location, schedules like for in the sixth week, the 10th week, 14th week, people get opportunities to have their babies immunized. Okay, and for adults, if you already have a test done and it's negative for hepatitis, viral hepatitis, then for hepatitis B, for example, you can get vaccinated. So you need to check with your your environment to know how you can get this done. So early detection is important, and that can only be done through screening and then monitoring, and then for proper treatment for those that need it. Now, the management will help to prevent complications. I've emphasized the liver cirrhosis, liver cancer that can develop from this cancer. What else do we need to talk about? I think we have covered most parts of this topic. So, do you have any question relating to this topic? Let me know in the chat. Do you have any experience that you want to share with us? You can share in the chat. Okay. So in the US, for example, there's universal immunization, which is recommended for all infants, and is scheduled for first dose at birth. That's within 24 hours. The baby should receive immunization against hepatitis B. Then second dose at 1 to 2 months of age. Then the third dose at 6 to 18 months of age. Older children can also receive catch-up vaccines, the 3-dose series over a 6-month period. So these are important for healthcare workers, high-risk adults, immunocompromised individuals. But for hepatitis A, for example, there's also universal vaccination recommended in children in the US. The schedule is first dose between 12 and 23 months of age, and second dose is between 6 to 18 months after the first dose. But for adults, vaccination is recommended following this similar to dose schedule. For travelers in endemic areas, individuals living with chronic liver disease, very important. So there is twin risks. That's for hepatitis A and B vaccine for adults, and it's indicated for adults usually 18 years and older who require protection against hepatitis A and hepatitis B, and it's scheduled for 3 doses over 3 months. Now for Nigeria, the immunization schedule focusing on hepatitis, newborns and infants are target groups, and they have their schedule within the pentavalent vaccine. First dose, the dose is received at birth, at first administered as soon as possible after birth, and to help prevent vertical transmission, which is that transmission that occurs between the mother and the baby. So that there is vertical transmission can also occur between individuals. So that's horizontal transmission. Now, vertical is between mother and child. So, subsequent doses after birth is first dose at 6 weeks, next at 10 weeks, then at 14 weeks. So, in some settings, they have these doses separated. Now, in Nigeria, hepatitis A vaccine, if you're in Nigeria, routine childhood vaccination for hepatitis A is not part of the national schedule. in most parts of Nigeria. So sometimes it's usually done on a private uh, basis where people have to make some payments. For travelers going to high risk areas, individuals with chronic liver disease, or those at increased risk due to specific exposures, health workers, and the rest. So first dose is given according to the healthcare provider's recommendation. Then the second dose is 6 to 18 months after the first dose. Any other information for us? So what are the key points, takeaways from this discussion? So hepatitis is actually preventable. You need to know that. And the vaccines for hepatitis A and B, and there are effective treatments for hepatitis C also. Then testing is key. Early detection. Some people come up or come in to the hospital when complications have set in, and that's not good. Early detection through testing can save lives and prevent complications like cirrhosis and liver cancer, as mentioned. Treatments can help to save lives. Hepatitis C can actually be cured, and if you need to know that, and hepatitis B can be managed with antiviral medications. So no one should be left behind. I think at the end of this session, the video the video will be available on the channel, the live, so you can get the link and share with people in your world. You can watch it again if you were not able to join from the beginning. So, Lady J, thank you for joining in and tuning in and engaging. We welcome you to the community. Rajesh, um, Charles Gold, and everyone who joined in. Diego M says, "Hi, today is my birthday." Welcome, Diego. Happy birthday to you. Where are you joining from? Where are you watching from, Diego? Are you in Argentina or where? Where are you? Where are you watching from? So some of the information provided from the United Nations, World Health Organization, these statistics which I've shared with us. So, Diego, happy birthday to you. Everyone, let's wish Diego a very happy birthday. Happy birthday, Diego. Right, so thank you for joining in. Back, I think I think it's cool. Diego, I want to say happy birthday to you. Hope you enjoy your day. So we'll be taking a break from this live, and I'll see you again on the next live. And watch out for new videos. If you are just joining in, you're welcome. We've been on this topic, interesting discussion on hepatitis, and if you should be able to actually go through the entire video where we really broke down. I broke down the different aspects when it comes to what hepatitis is, looking at the causes, looking at how the diagnosis is made, and then the management, how to prevent hepatitis. So I'm sure you will find this informative. So you can also share with people in your community and let me know what you think in the comments. Okay, so I'll take a break from this particular session and I'll see you again soon. Okay, some people are just joining in, but we have to go now. All right, see you later. Bye for now.